Hello, Kings A&E. In 10. Thank you. Bye. 10.
King's College Hospital, London. A major trauma centre.
Have you got her blood pressure yet?
She was on the floor and I thought she's dead.
And one of the busiest A&E departments in the world.
Stabbing, code red.
King's is everything. Everything pounds in through that door.
The badge has been trapped between him and the bridge.
A place where love.
Can I wait here until she comes home? Can I come home with her?
Life.
Oh, apart from having a brain injury, never better.
What happened?
I got bitten.
By who?
By me mate.
And loss unfold every single day.
I've not got a happy feeling of you. Not breathing.
All the patients you're about to see were treated in one department, in just one 24-hour period.
You're going to be all right. You know what happens when things are bad? Daddy's here.
Please don't cry.
The moment that you're in resus and you're really sick and all you can think about is, am I going to live, am I going to die? Silly things go out the window. And ultimately what's important is realised that you're loved and that you're not alone.
I've been asked by 3 patients this morning how old I am and whether I'm qualified yet. She went, how long have you been a doctor? And I was like, I've been qualified for 4 years. She was like, OK, you can take my blood. I was like, thanks. Morning.
27-year-old Matt is among King's A&E's newest recruits.
Hello, sir. My name's Matt. I'm one of the doctors. Nice to meet you.
Today, he's based in resus and will assess each and every patient.
So you finished the 5K, then you start...
Race the 5K, yeah.
Race the 5K, sorry.
Yeah.
Race the 5K.
17 minutes, 7 seconds.
There's this thing when you apply to medical school saying, why do you want to be a doctor? When everyone is told not to say, I want to save lives, I want to help people. But why else would you go into medicine?
Like my ears start swelling inside my ears, and then I start feeling dizzy, start to lie down.
This is what you get for exercising on a Saturday morning.
Yeah, exactly. Yeah.
This gentleman here was assaulted last night. Yeah, kicked and punched into the head.
It's really difficult to comment on my own bedside manner. It's not something that is really taught to you, and professionalism isn't really taught either.
No blood seen, triage complaint, C2 and C3 tenderness, declined analgesia.
If it's a young patient, my kind of age, I'll say, hello, my name's Matt, I'm one of the doctors. If it's someone of an older generation, I'd say, hello, my name's Dr. Mac. Or in between, I'll say Matthew. I think only my parents call me Matthew.
Hello, sir. My name's Matthew, I'm one of the doctors. Nice to meet you. Tell me what happened last night.
I was walking to get a taxi.
Yeah.
And the mob of these youths just started punching into me, and well, they ended up knocking me down. And then I kicked it into their face.
OK.
He's only been in the country 4 days and doesn't know the area, so...
Welcome to London.
I'm not very much like, me doctor, you patient, have this painkiller, trot off now. I try and create a dialogue.
I just wanted to give him a hiding.
I'm sorry about that. It's rubbish, isn't it? We don't think there's any need to scan your head, but we'll give you some painkillers to go home with, and if the headache gets really bad, then come back.
People who do A&E as a career like a good story. They like the drama and they like the adrenaline. It was the left that they said, is that right?
Yeah.
OK, that looks absolutely fine, that side.
Sorry.
It's all right. OK, no, everything's fine.
I love resus. You have to juggle so many things and still manage to deal with whatever's going to come in next.
All right, enjoy the rest of your day, and you'll stay here. Okay?
Yeah.
Bye, thank you.
Try.
Right.
Hello, Kings A&E. Yeah. Yeah.
On the horse.
In 10. Thank you. Bye.
Hems, red phone, 10 minutes. Hems, red phone, 10 minutes.
If the red phone rings, and it's not the usual person on the end of the phone from the ambulance central control, it's someone on a mobile, and then you know it's one of the helicopter service doctors, you know it's serious. And then you know that you need to get your trauma team together.
Kirsty, are we going to 5? Okay.
Do you want her to be the B-dog?
I get a mini surge of adrenaline. You'll never get rid of it, ever. I don't know.
5, it's female, yeah? Anyone for a polo before we begin?
This patient is a 16-year-old girl. She's been flown to King's from Kent.
So, plain film C-spine and chest, guessing, straight off.
Yes.
And withhold the pelvis to reassess, young girl? Or, yeah.
Dan is in Resus 1 helping us put a line in, your A-man, so he will be down here.
Trauma calls that involve young people are a whole different ball game.
Okay, we'll go on move. Ready, steady, move.
You've never seen more people around a bed than a paediatric trauma pool.
Okay, ladies and gents, this is Ellie. Ellie is 16. She was riding her horse this morning when it was spooked. The horse then galloped into the yard and into a fence, with her falling between the horse and the fence. She was crushed between these. On our arrival, she had a GCS of 15 and was complaining of reduced sensation and power in her left arm and left leg. Her left arm was in 130 degrees of abduction. She was markedly tender at C2 and C3, with this persisting left-sided sensory reduction. She's been stable in transit, no volume issues, and her immediate needs a further full assessment and neurological assessment.
Ellie. Hello, my name's Matt, I'm one of the doctors. Hello. I'm just going to put my fingers on your neck and have a listen to your chest. Any pain when I press?
I can't feel it.
Any? Can you? But you can't feel that. Okay.
Not very much.
Ellie has been crushed by her horse during her regular riding training.
Okay, and just breathe in and out for me, Ellie.
Falls, especially from a height, like a horse, you worry about injuries to the spinal cord.
So, trachea is central, air entry reduced bi-basally, reduced sensation on the left anterior chest wall.
Keep your head still for me. I'm just going to remind you to keep it still.
Sharp scratch, Ellie.
Which arm? Your left arm?
Yes, my left arm.
What about your left leg?
Left leg, I can't feel it.
Sorry. If they're complaining of not being able to feel anything below a certain level, that's when you think it's serious.
Oh, the child has metal ball inside right ear. Oh dear.
More than a quarter of all King's A&E patients are under 18. They're seen in their own specialist paediatric department.
Right. Okay, that's my You enjoyed yourself?
It's a funny place to walk into that waiting room sometimes, watching all these kids tearing around. You're thinking, which one of you are meant to be sick? Adult patients come in and they're like watching the clock, and I've been here for too long now. they have an expectation of what might be wrong with them and what they want done about it. Whereas I think a child just goes, oh, okay, I'm going to go and get better. Sure.
Today, Jackie is overseeing the whole of the emergency department, from paediatrics to resus.
MTC Charlie Black is a 16-year-old girl who fell off a horse, crushed between a horse and a fence.
So what's happening with her?
Waiting on a formal report of the C-spine neurosurgeons coming to see her.
Young people are only taken to the resus room if their injuries are serious. 16-year-old Ellie has been thrown from her horse. The trauma team are waiting for her condition to stabilise before she's given a full body scan.
Do you guys want another chair, or are you just gonna stand?
Okay, good girl. Deep breath. So was it bumpy in the helicopter then? Is that what made you feel sick?
I don't know.
Is it very small in there?
Mhm.
That's why I couldn't go then, isn't it?
Mhm.
We had a phone call. Ellie's had an accident and they've called an ambulance. Your back hurts. When I got there, the air ambulance was there, the paramedics, the first response and the ambulance were there, so there was lots of people around her. There's not much I can do apart from reassure her, and I couldn't really even do that because it's quite obvious that she wasn't all right.
Might need to get you some more painkillers out.
I wasn't there, and I'm always there, and I'm always being told that I need to let go and let her do things for herself, because obviously she's old enough to do that and clever enough to do that, but I'm always there. This time I wasn't.
He was crazy, Mum.
He's never been like that before, has he?
Matt,
yes.
Are you able to keep an eye on what's going on in here? I just want to make sure that she remains cardiovascularly stable because we don't actually know the extent of her injuries until I've seen the CT.
Okay.
It's been 30 minutes since Ellie arrived in resus. The doctors have decided she's now stable enough to be taken for a full body scan.
I don't think you can ever say straight away whether someone's going to be okay or not. Sometimes you don't have the answer until you've put them through the scanner, and that's the honest truth.
Yeah, she's been crushed between the horse and the fence. She's insensate down the left-hand side of her body.
I'm going to run some water through your arm. Yeah, here.
She was 6, and off we went to the local riding stables, and yeah, she started having lessons. Ellie's had such brilliant times competing and in the ring, or just going out for a hack on her own, just doing it, her and her pony. It is a risk sport, it is a risk sport. They're not robots, they're animals, and so accidents happen. That's a chance you take. We do spend a lot of time together, and it's finding that balance between letting go and giving her independence and still being there. It is hard, really. You can't live their life for them, can you?
COPD, right, let's sort this man out. Oh, he's got a temperature. He's going to need an arterial, but I'll do a venous anyway.
Do you use your arterials?
Not at the moment. I know how to do them.
Yeah.
Let me talk through my arterial blood gas.
Medicine definitely not in the family. School's not even in my family. I was the first person in my family to do A-levels.
So I would feel for your radial pulse like this. And once I've got it strong, I've got it so strong underneath my fingers now. I can feel it pulsing underneath there.
Stop talking dirty.
I'm not, I'm just talking radial pulses
Okay,
here.
go on.
My parents got a takeaway in just outside of Liverpool, which is where I'm from.
Straight in.
Yeah.
Bosh, Bob's your uncle, Fanny's your aunt.
Bish bash bosh.
Bish bash
Shall I show you
bosh.
how I do it?
Go on, show me.
They know I work shifts, but I don't really think they know what I do.
And I put my hand here
To hold that hand
to hold
out
that
the
hand
way.
because they will go. Yeah, exactly. And if I do that, then they can't.
They can't move
flinch.
it. Thanks for that. That tip is going to stay with me for the rest of my life.
Yeah, 1 second. Daddy, wake.
Oh, Destiny, I thought you... Destiny, Anosike.
4-year-old Destiny has been eating fish curry. A bone is stuck in his throat.
Hi, come in, take a seat. Do you want to jump up onto the bed? And is this your mum?
Yeah.
Mum, if you jump up onto the bed and your mum can take a seat here.
Okay, did you see?
I'm just going to grab a thing to have a quick look in his mouth, if I could find it. The nurses have told me a little bit about what's happened, but if you could just tell me what's happened to him.
Okay, it was around 11, 12-ish, you know.
The fish bin was in my mouth every day, every night, and every morning.
So you're having a fish, you had some fish today, did you? And does it have bones in it, obviously?
Yeah, it's got bones in it.
It's blood around it.
Blood around it. Okay, all right. Well, you're very cute, aren't you? Yeah, all right. Does it hurt anywhere at the moment?
No, it's so when I swallow it.
When you swallow, do you want to lie down for me? If you put your head here, as if you're about to go to sleep. Open your mouth for me as wide as you can. Oh yeah, I can see it. All right. Just give me a few minutes, and I'll see what I can find.
All right, thank you.
All right. Okay.
Should we go?
No, let's wait.
Wow, I'm going to take for ages. I'm coming down.
No, wait.
When I get Gary, then I put soup in it, then there was a bone, then I eat it, and then it was stuck in my throat. So painful.
How big's the bone? How deep's it in?
I don't know how big it is because I haven't x-rayed him, but there's about that much poking out, enough to grab it and pull it out. Hi, hello. This is one of my consultants, Dr.
Hello,
Butler.
how are you? What's your name?
Just going to have a quick look in his mouth.
What is it? Destiny. Well, my name's Jackie. I'm one of the doctors. I've just been hearing that you've been eating a lot of fish and you didn't chew it up properly. How old are you?
4.
4? 4, nearly 5, or only just 4?
Nearly 5 when it's my birthday.
You have to be able to interact with children, so you've got to engage with them, and because chances are you're going to do something to them that they don't like. You going to show me inside your throat? But I think you've still got to manage to look like a sensible doctor in front of the parents while you're being a fool with the child. It's a fine line. Are you ticklish, Destiny? A little bit. Not sore down here?
No.
Do you want Shameen to try and fix you? Yeah?
Yeah.
Okay. We'll just go and have a look and see if we've got something to spray it to make it a little bit more comfortable.
The fish bone was this big. It was very, very sharp.
We're going to bring a little kid around just to try and pull a fish bone out of its tonsil. Hey?
Where's his fishbone? Stuck in his nose?
No, in his tonsil.
In his tonsil? Ow, that's going to hurt.
No, he's just like...
Yeah, I don't mind giving it a go if you want to.
No, Shamim is giving it a go, and if he can't do it, I'm doing it. should see this child. He's so cute. Just like, show me. There he is. It's the man. Isn't he gorgeous? Big for 4. You just got your mouth open already.
Okay, can you go up here?
Wait, there we go. Now, do you know what we're going to do? We're going to try and pull the fishbone out, aren't we? I like that kids, generally speaking, have no hidden agenda. It's like, I'm sick, and if you make me better, then I'll be really happy. Say ah, ah.
Okay, you ready?
Nice and big, nice and big.
Wider. I'll say really wide.
Really wide like you were before.
Really wide.
Like you're singing. That's it.
Good boy, you're okay, you're okay.
Singing.
Good boy.
Keep it open.
You know, some people, Destiny, are frightened when they go to hospital.
Not me, I'm so strong and brave.
It's okay, well done. Doing really well. Really are. Well, good boy.
Good, thank you.
Trolley to cubicle 11 in majors, please. Porter with the trolley to cubicle 11 in majors.
The swelling looks like it's coming down now, for real. Yeah, I can actually see your eyes. When I picked you up, I couldn't see your eyes.
I'm not even listening to you.
Right, I'm not going to laugh at you no more. I love you, though.
Don't touch me.
I love you, though.
Don't touch you. I feel like I should join in. I've only got the dance moves, guys. I can't sing, though, you know?
He's the only one singing.
We could be a really cheap new boy band.
We'd have to have
Throw it at him. Talent.
Looks. No, it's just the look.
Kind of we're a bit deafy on some things, aren't we?
Best thing about working in Kings is the team. And you can have a laugh, even though you're dealing with a full range of human emotion.
Hello, Kings A&E.
Adult red phone, 7 minutes. It's an adult red phone, 7 minutes.
And a striker trolley to recess, cubicle 9. Thanks.
Trolley to recess.
A pregnant woman is being brought in by ambulance. She has severe blood loss. The medical team have less than 7 minutes to prepare. Jill is 36, a mother of 3. She's in the early stages of another pregnancy.
Oh, yes.
Does it come and go like labour does?
Yeah.
7 weeks.
You 7 weeks?
Yeah, 7 weeks.
Yeah.
About 3 hours ago, sat on the toilet, she's been passed clots, heavy clots, heavy bleeding. Right, there's blood everywhere in there. Really painful down below. She's had 8 previous miscarriages.
Okay.
We've given her some Entonox, we've given her some Metacold cream. She's much more comfortable now. She stopped screaming and shouting.
Okay. My name's Matthew, one of the doctors. Nice to meet you. How is your pain now?
It's about a 7.
Okay.
I don't feel to push no more.
Oh, did you have the need to push?
Yeah.
Okay. All right.
Kinda slow
Okay. All right.
For people who come into resus, they must be terrified. The commotion of everything that's going on around them, strangers that they've never seen before coming in, sticking needles in them, examining them in the most vulnerable state, naked but a gown. I can't imagine how terrified they must be, really.
Bleeding in pregnancy, there's a high chance of miscarriage, but you know, 1 in 4 or 5 pregnancies, people bleed, yeah.
Depending on the gravity of the situation and the support that a patient has, I think as a ground rule, you should be as honest as you can.
How much do you think you've lost?
Jesus Christ. Loads.
Would you say cupfuls or bowlfuls?
At least 2 cups.
At least 2 cups?
Yeah, easy.
Okay.
I was bleeding for an hour before I called the ambulance.
Okay. And you've never had a miscarriage like this before?
Not like this before, no. Not like this. We had a very traditional kind of upbringing. As I grew up, I wanted to be a nun and I wanted to live a spiritual life. And then I realised I actually wanted to have children. I wanted to be a mum.
Okay, so one of the reasons why you might have in this pain and the fact that you're feeling this unwell might be because you might have a clot stuck in your cervix.
You can move it down then or something, because
That's what I'm going to do. I need to lie you down. I need to examine you and see what's going on. Is that all right?
Mm-hmm.
Okay?
When you've had more than one miscarriage, you feel that, you know, you get over the grief and the loss because you have this idea to look forward to, and you have this, it's almost like a compensation by saying, well, yes, you've lost that baby, but you'll try again, and the next time you try, you're going to have that child. It's coming and going.
Yeah.
Okay, so I'm going to put your head down.
Yeah.
Sorry, dear, sorry.
That's all right.
Okay, I just need to examine you, okay? I can't see anything. There's just a bit of blood in there. I need to see what's going on at the cervix, okay? So sorry about this.
All right, that's okay.
Well done. Any pain when I press here?
There, yeah.
Yeah? Here?
Ow. Ow!
Okay.
Wow.
Okay, sorry.
My God.
Yeah, you should have used your left hook. Right, let me cover you up.
Oh! Did you see where it's coming from, if it's a cyst or something?
My hands aren't as magic as ultrasound, I'm afraid. I think you do need another scan, and I'll speak to the gynaecologist, but let's just keep the blood pressure on 5-minute cycles. Right, let me get you some paracetamol, shall we?
Paracetamol after they just gave me morphine. I need something stronger.
Paracetamol in the veins is as good as morphine.
Now, can you move your fingers for me? Good. Can you move this one for me? Oh, come on. Give it a really good go.
Ellie's been in resus for nearly 2 hours after being thrown from her horse. The scan hasn't revealed the cause of the weakness in her leg.
Now what I want you to do is just to squeeze my hand really hard for me. Come on, give it a really good go. Bit tricky. Okay. It just hurts. Is it because it's hurting, or is it because...
I'm trying as hard as I can.
Try harder, and harder.
Oh, I can't go to pieces at all. If I had got worried, that would have been it for Ellie. And so therefore you don't think about it too much, you just deal with what's in front of you. So we all had to be stiff upper lip and all that.
Right, the neurosurgeon's just come in and they're going to do an MRI scan just to make sure that there is no damage to her spinal cord, basically. So, fingers crossed.
That horse can go now.
Can it? Because of the nature of the fall, I'm thinking any minute now you're going to tell me something really horrible. And it's the sort of scene you've seen on the television all the time. And you think you don't know quite what they're going to say.
I couldn't stop. I was standing up in my... It's not so I was standing up in my stirrups.
Yanking him.
One
hand on the neck.
One hand up, and he was just
Didn't give a damn.
faster and faster.
Okay, that was left brain. That was left brain, wasn't it? That's instinct. Because he couldn't get around the corner.
No.
That's not normal, is it?
I don't know what went on. I don't know what happened.
No.
I just give up.
Well, we'll sell him, Ellie. We'll just get rid of him.
Oh, in the middle of my vagina. Oh, this one is bad, yeah.
Is it pain, or?
Pain. It's really in there, yeah.
You have 5 kids.
I have 3 children. The rest I lost them. I've never had a miscarriage this painful.
So how many miscarriages did you have?
7. This would be 8 now.
7 miscarriages you had.
So I've got 3.
And 3 babies.
When I first became a mum, it was the best experience for me ever. Like, the grief that I'd gone through in the past before didn't matter anymore. Words can't really even describe what it's like to feel that sense of joy. I used to feel his warm breath, you know, on my face. I just felt that I had a sense of belonging with him, you know.
Marie, I'm one of the senior registrars.
Hi.
Jill needs an ultrasound to determine whether or not she's still pregnant.
I warned you that we might not be able to.
Yeah, I know.
You're right. Yeah. It does look a bit pale.
Jill is 7 weeks pregnant. In the past, she's had several miscarriages.
I don't care about being pale as long as my baby's okay.
In a few moments, she'll know whether or not she's lost her baby.
You can't see any of the bleeding.
I can't properly.
Yeah, look.
It's in here. Yeah. I can't realistically be able to tell you whether or not there's a heartbeat. Yeah?
Yeah, but if there's a baby, then obviously the baby's still in there. Oh!
Can you see?
Yeah! I can see it! Oh, Jesus, that's so good. What a strong baby. Oh, so much blood. Oh my God, I can see! Yeah! This baby is a miracle.
All right. You happier now?
I'm so happy.
There we go.
I can't believe it. Thank you. You are angels, man. You're angels. You're angels. Thank you so much.
How many minutes?
5.
About 35 minutes. We're getting to 1.
Paramedics are bringing in an elderly woman who they think is having a heart attack. Her children and grandchildren have come with her to King's.
Feel like you're a bit flattish for a second, is that right?
I'm just going to pop this onto your hand, okay, to take your blood pressure.
Trouble with her breathing. It's all over the place, there's depression everywhere on it. She's not complaining of chest pain at the minute, it's just the problem with her breathing.
Hello, my name's Matthew. I'm one of the doctors. You've met Kirsty and Laura. They're our super nurses. Do you have any pain in your chest? Has it got worse at all since yesterday? No. Do you feel short of breath? I rarely let myself get involved in a family situation or in an emotional situation because you don't want to appear weak in front of patients or in front of their relatives. What we need to do is just have a little chat, and then what we're going to do is pop a line in and we'll find out what's going on, OK? We'll take some blood and check your blood pressure. Can we get a 12 lead as soon as we can? We'll try and make you feel better.
My back's not good. I'm going to have to stand like this, I'm afraid.
Your back's not good?
No. It's really not good. I think I need to be on there, actually. You get off.
Right here?
Get off.
Oh, OK. Take this stuff off me. From the top.
Yeah. I should have asked if I could have a scan. I could have nipped in there with you and we could have had a buy one, get one free, couldn't we, scan? There's bits of yard everywhere.
Ellie's waiting to be transferred to a specialist ward for further investigation. So far, all her test results have proved inconclusive.
If the neurologist person thingy can't find anything wrong, does that mean that I can go home, or does that mean that I need to find out what's wrong?
Well, I'd say that we need to find out what's wrong. You have got some weakness on this left side, okay? You know, when you've tried to lift your leg, you haven't been able to lift it very far, okay? And so the reason why we've done all those scans is to see in real depth why that is, obviously. And the other thing is, sweetheart, I know you want to go home, but how are you going to go home with your leg? Hey?
Get them to carry me.
Everywhere?
Yeah.
For the rest of your life?
Yes. I'll come back tomorrow. I really don't like hospitals. I know that sounds silly.
No, it doesn't sound silly. I don't like hospitals either. Right, your blood pressure's back up a little bit. Let's get you that morphine.
Initially, we were relieved that she hadn't broken any bones. The scans were coming back clear. There was nothing too major to worry about. Whatever had happened would repair itself. We didn't really appreciate what else could be wrong.
Several things can make a bad day. When you can't quite get the answer of why someone is unwell, you know they're sick, you know they're unwell, but you can't quite put your finger on why. Even with all the barrage of x-rays and blood tests and camera tests and everything, sometimes you just don't have the answer, and that's really hard.
How soon till she goes to CCU?
She's not going to CCU at the moment. She's not stable enough, he said. He said he's afraid she'll go along the way.
The elderly woman's condition is deteriorating.
How, Brady?
She went to 38.
Okay. Can we get the paddles on her?
Paddle?
Yeah. She's got a pulse. Let's get another 12 lead.
I'm going to get the family to come in here because she's going to go in a minute.
Okay. We need room 10. No, I've got a dying patient.
The next patient to arrive in resus is a terminally ill man.
Death is part of life, and death is expected. But when it's a death that happens on your watch, it's, you know, you take a step back and you think, what could I have done?
Okay. Don't worry. I don't think, you know, that family of vets in.
No, they didn't have good news, did they?
It's a bit awkward, like, you're talking away and
You can't all sit there like your life's ended when it hasn't.
someone else's house.
Yes, ma'am.
So, Nine's just died.
Oh. Okay. Is it family or anything?
Yeah, so family are all there, family are all aware.
Okay. Oh. You can't be a doctor and not appreciate that people have to die. Even with all the best will, the best experience and skill, not everyone can be saved. And I also believe that, you know, sometimes not everyone should be saved. It's actually not in the person's best interest to stick them in intensive care on a ventilator and drag it out for another few weeks.
2 of these conversations in a day is just...
It's not your fault, Dr. Mac.
I know. I'm fine until the bit I write, may he rest in peace, and then that's just... I think if you don't feel like that when you certify, then you shouldn't be doing the job.
Well, write your notes and then go and have your
Yes,
break.
I will.
It's always something very poignant when the last thing that you write in the patient's notes are, may he rest in peace. It's one last dignified sentence.
Matt. You have a look.
Are the family okay?
Yeah.
Most of the time when I'm at work, I try and separate my family life and my work life.
Let's give it another few minutes.
I come from a very matriarchal family on both sides. My grandmother has got to this stage where she's got chronic health problems. And I guess I kind of saw it in that family. The grandmother was the head of the family, and seeing all her children, seeing her grandchildren all pile into resus, I think that was one of those moments when I thought, you know, well, that could be back home in Liverpool, that could be my family.
Go and have a little breaky break.
I just need to.
You need to go and have a break. I'll just order an X-ray and then I'll go and check he's around.
Yeah, I just need 5 minutes of air.
Go upstairs, sit down.
I just need to certify first, and then I'll go, honestly. The phone's here, the notes are here. I'll be fine, promise. Brian, my name's Matthew, I'm one of the doctors. Nice to meet you. Do you have any allergies?
No.
Okay, and what do you take?
That's one good thing, isn't it? At the moment, I feel good.
You feel good?
Yeah.
That's the right answer.
Yeah.
The ambulance saved you.
Yeah. Yeah, good old Kings.
It's been one of those days. One of those days.
So tomorrow's
Hopefully I won't see you tomorrow. That'll be a good day.
With A&E, you need a bit of stamina. You need a good sense of humour.
Right.
Go. Thank you very much.
Thank you. Sayonara.
And you need to be able to forget everything when you leave because you know you've got to do the same thing again the next day.
The physio told me that my brain didn't connect to my left leg at all. And then he says it's going to take months for you to learn to walk. And you just think, I can't do this for months. I've never had a horse fly off of me like that. But I've been doing this since I was 6. One time, one fall, you can't let that stop you.
Sadly, the more miscarriages you have, when complications happen in the pregnancy, doctors tell you, oh, well, you don't really have a good track record, so it's more than likely to happen again. For me, my compensation now isn't that, oh, try again, Jill. It's I look around and think you've got 3 beautiful sons, and I'm blessed to have them.
That noise.
Please don't do that!
I think traditionally men don't tolerate pain as well.
I suffer from overexcitedness.
James, let's give it a minute.
If there's a male equivalent of childbirth, you've just been through it.
Thank you.